With temperatures dropping into the -30s in Saskatchewan, people who are homeless must desperately search for a spot to warm up. For some, the search is over. Every day, this housing support team makes its rounds, checking in on people who now have homes but are still getting used to it. Stephen Ledoux lived on the streets for years. He broke his neck in a construction accident and began drinking heavily.
Hello! How's your morning?
Pretty good so far.
Ledoux says he used to spend his days digging in dumpsters and drinking with friends, often getting arrested.
Drunk in public, drunk and disorderly, just staggering around the city.
That all changed when he got accepted into the Housing First program 3 years ago. He says you can see the difference.
Right here, a house. They found me a house as soon as I got into the program.
And then how has that changed your life?
I've been in trouble with the law, and I'm staying pretty good sober now.
Over the past decade, Housing First programs have become common in Canadian cities, touted for their simple premise.
So it doesn't matter if people are sober, it doesn't matter if they have bad records of tenancy, nothing matters. As long as they are homeless and in need of supports, we put that in place first, and then you can work on everything else after.
Kendra Giles with Phoenix Residential Society runs the federally funded program in Regina. It has 30 clients. She says Housing First makes even more sense in a pandemic.
You couldn't get a more perfect setup. Given that everyone has their own safe place to call home, people can actually be in a safe place to isolate, and then we can bring the supports to them.
Her teams make more frequent visits now, delivering groceries, medication, and even alcohol.
Depends what they like. Beer, vodka, whiskey, or wine.
All safer than drinking mouthwash or hand sanitizer. Phoenix received more money from Ottawa this past year to expand its managed alcohol program.
We got your beers here.
Thank
there
you.
You go. You're welcome.
Thank you.
3 deliveries a day stops people from going to the bar or liquor store.
Okay. Have a good day, Wilfred.
Yeah.
Bye-bye.
Yeah.
57-year-old Army veteran Rudy McQuaig waits for the Phoenix team to arrive.
They come and check my house, make sure I'm okay, so they're very protective.
Rudy, hello. How was your night? What'd you get up to? Just got your medication here.
Caseworkers helped him collect social assistance to pay rent and buy groceries.
Okay, you have a good day, okay?
A couple clients have contracted the virus and they get support to self-isolate. Overall, there have been fewer visits to the hospital emergency room, detox center, jail, and shelters, which can't meet demand. COVID-19 outbreaks have temporarily shut some down, and physical distancing rules have cut capacity. Jason McCurdy's organization serves vulnerable people, but due to the pandemic, has to frequently turn them away.
Pretty much every day where the temperature drops below -15, we have people begging us to let them in the building. It's not just us, it's every organization in the city that really is struggling to allow people in and maintain COVID protocols. And we've had people crying, we've had people quite upset.
But for Stephen Ledoux, his biggest challenge now is boredom.
The more you sit around, the more you want to drink.
A Housing First social worker helped Ledoux get a cat, who he named COVID to keep him company.
So I just mainly stay home.
And for that, Ledoux is proud of himself. When public health officials urge people to stay home, it's something he can finally do. Bonnie Allen, CBC News, Regina.